Hi, I am Dr. Sudipta Kumar Ase, consultant ENT and head and neck surgeon. Today we shall discuss about the most important topic, that is a disease. This is not a disease, this is a symptom, that is tinnitus. Tinnitus is very important topic because most of the patients when come to our OPD or when come to the hospital, they mostly complain about the tinnitus. So first today we should know what is tinnitus, what are the symptoms and what are the clinical features and how can we treat. The most important thing of tinnitus is that tinnitus is the ringing sensation in the ear. What is the ringing sensation? Means patient will complain about anything ringing or anything sound coming from the ear. And the most important thing is that when the patient come to us, mostly they present with tinnitus since we have to know the proper history, whether it has been started within few days or within few months or it has been started a long ago. The most important thing in tinnitus is that we have to evaluate properly what is the cause and how can we treat. The most important thing we should know the type of tinnitus. The type of tinnitus we should know is that mostly the tinnitus are of two types. One is subjective tinnitus and another is objective tinnitus. The most important thing is the subjective tinnitus is that patient will tell patient is having a ringing sensation or ringing like bell or anything sound coming from the ear, and objective tinnitus is that the patient and doctors also listen something sound coming from the ear. The most important thing and clinical feature is that we should evaluate whether the patient is having deafness, means the patient is having hearing loss or not. The most important thing is that tinnitus with hearing loss and tinnitus without hearing loss. So most important during the OPD patient we have to do how to evaluate. So mostly when patient come to us, we first do a otoendoscopy. What is otoendoscopy? We have to see the proper tympanic membrane with 0-degree endoscope in a OPD basis, so that we can know whether anything tympanic membrane is intact or it is perforated. Secondly, after seeing all this, we have to go for a P-Orton audiometry. The most important thing is that in P-Orton audiometry, we have to know whether a patient is having sensory neural hearing loss or conductive hearing loss or they have been mixed hearing loss. After evaluating the PTA, then we can know the patient having hearing loss or without hearing loss. If the patient having hearing loss, then we have to go for proper evaluation of the hearing loss. Then we have to go for the proper exact treatment and what is the cause. The most common etiology in tinnitus is that mostly the patient have normally with hearing loss, we have to evaluate for any disease such as any glomos tumor or anything acoustic neuroma, anything disease or anything problem in the inner ear. So mostly we have to evaluate all this through CT scan, and we have to do a CT scan of the brain and temporal bone, and total we have to, after that we have to go for a MRI also. If CT scan is not conclusive or inconclusive, we have to go for MRI. And the most important thing in tinnitus is that when patient come with severe tinnitus, we have to admit the patient in a hospital for a day or more than a day. Then we have to evaluate properly in a hospital IPD basis, and we have to do all the investigation starting from CVC, CT scan, MRI according to the symptoms present and PTA, and after that we have to go for a conservative treatment, means symptomatic treatment. For treatment purpose, we have to evaluate all the causes of tinnitus and etiology properly, and we have to treat the patient. And the most important thing in the treatment is that when patient come with severe tinnitus, we have to admit the patient in a hospital and we have to treat the patient through injectables or oral medication, whichever is most important or needed to the patient at the time. And mostly on the OPD basis, we have to give the symptomatic treatment for the patient having tinnitus, and we have to give the treatment as soon as possible, and we have to follow all the strict restrictions which have been told to the patient. And secondly, the most important thing is that during the hearing loss, we can use also tinnitus masker. Tinnitus masker means a hearing device which has been inserted in the ear, which will produce a noisy sound, so that the patient will feel calm and quiet during the proper during that period. And most of the patients having good after using tinnitus masker, they mostly after using the tinnitus masker, mostly they can easily know whether they have been tinnitus has been decreased or not. So this is the most important thing we should know about the tinnitus. As such, it is not a disease, it is a symptom, mostly from the inner ear. So most of the time when the disease is very severe, a small minor surgery it can be done. That is the surgical intervention, that is we can go for a cochlear nerve innervation, but it is not done. Mostly medications and total we can go for the disease restriction, and we can evaluate the tinnitus properly. If you are being on the MRI on CT scan, you are being something disease coming from the inner ear, that is glomus or anything tumors, then we can also treat properly according to that investigating reports. So this is the most important topic we should know. And the most of the patient, they also misguide by some others, misguided, and they couldn't know why the ringing sensation is coming from the ear. So I should tell all the patients, those who have been tinnitus or ringing sensation in the ear should immediately consult to an ENT doctors or anything. ENT specialists are also present in the various district headquarters, so they can easily come to the doctors, so that they can easily evaluate what are the causes and why the tinnitus is being going there, so that they can easily also evaluate properly. All that treatment also can be done easily. Thank you.